Good afternoon, ladies and gentlemen. My name is Genet Kebede. Today I'm going to talk about diabetes. Um, we often hear the word diabetes in the media or advertisings on a new type of medication against type 2 diabetes. We know what diabetes is. My speech is going to focus on how type 2 diabetes affects our pancreas from making enough insulin, its symptoms, complications, and way of manage and control the disease. Doctors tell us when there is inadequate insulin in the body, our body sugar goes up. This prevents the cell from functioning properly by preventing glucose from getting into our body cells to give us energy. So, what causes type 2 diabetes? According to the research by Mayo Clinic titled Free Fatty Acid and Insulin Resistance in Diabetes, type 2 diabetes is caused due to an overload of free fatty acid in the body. The research also reveals that the free fatty acid leads to insulin resistance and raising blood glucose level because it prevents the cells from absorbing glucose. Free fatty acid attack the pancreas and the liver and stopping them from producing insulin. Additionally, such factors as weight, fat in the abdomen, sedentary lifestyle, family history of diabetes. So, what happens when the normal glucose level in the blood is not maintained? Doctors tell us that the uh, accum- uh, accumulation of too much glucose in the blood would lead to serious complications such as damage to the heart and blood vessel, nerves, kidneys, eyes, foot, and so on. But the American Diabetes Association tells us if we are well informed about the risk associated with the disease, serious complications may be avoided through proper management, treatment, healthy eating, regular exercise, blood glucose monitoring, diabetes medication, and education. So, do we know if we have type 2 diabetes? The symptoms of type 2 diabetes usually develop slowly. In fact, it's possible to have type 2 diabetes for years without knowing it. It's therefore important to educate ourselves in order to avoid the risk of serious health complications. So, what are the symptoms of diabetes? According to the mayoclinic.org, the symptoms of type 2 diabetes include the following: increase thirst and frequent urination, increased hunger, weight loss, fatigue, blurred impaired vision, slow healing source or frequent infection, headaches, and loss of consciousness. The above symptoms are warning signs to get timely diabetes tests. What are the complications resulting from type 2 diabetes? According to the mayoclinic.org, the complication of type 2 diabetes include the following: nerve damage, heart, eye damage, kidney damage, foot damage, uh, hearing uh, impairment. So, what needs to be done in order to avoid this complication? The American Diabetes Association recommends routine screen for type 2 diabetes. The glycated hemoglobin A1C test is undertaken to damage type 2 diabetes. An A1C level of 5.7% indicates normal level, while an A1C level of 6.5% of higher uh, on two separate occasions show a person has diabetes. But A1C level between 5.7 and 6.4% indicate a person has pre-diabetes. A blood glucose level less than 140 milligram is normal. A blood glucose level more than 200 milligram show diabetes. A reading between 140 and 199 milligram shows pre-diabetes. After the diagnosis, a patient must follow with their respective primary doctors for checkup for the A1C level at least 2 and 4 times a year. In conclusion, people with type 2 diabetes should make themselves educate uh, about the disease and make every effort to keep the blood glucose level with normal range. Doing so can help to delay the hamper health complication from happening. The American Diabetes Association recommend healthy eating, regular exercise, diabetes medication, and blood glucose monitoring as a major task to properly manage type 2 diabetes. Thank you for listening.